Hello, welcome to Diuretics. We're going to talk about Pseudotumor Cerebri today. Diuretics are for medical professionals. We provide useful information within a few minutes. Pseudotumor cerebri is also known as Idiopathic intracranial hypertension, IHH. Pseudo means false. It is a false or mimic a tumor in the brain, but there is actually no brain tumor, but it did cause increased intracranial pressure. The most commonly diagnosed at 20 to 40 years old, especially between the age of 30 to 40. The main symptoms are headache, and patient may report intracranial noise. About 60% of them will hear some kind of ringing inside the head. They may also have back pain and neck pain. They can also have transient visual symptoms such as blurring, and it can last for a few seconds each time. They can also complain of having floaters in their eyes, and they can have retrobulbar pain, that means the pain behind the eyes. They may have diplopia, especially from sixth nerve palsy. And about 30% of them will have some sustained visual loss. An examination will show papilledema, visual field loss, or sixth nerve palsy, and it's recommended that the patient be evaluated by an ophthalmologist. And on exam by an ophthalmologist, they can see papilledema. Visual field testing may show some visual field loss. And patient may have sixth nerve palsy. In this image, when the patient is looking to the front, their eye may be slightly deviated medially, and when they look to the right hand side, there's no problem. But when they look to the left hand side, the patient is not able to abduct the eye, or the left eye is unable to move to the side. MRI scan may show an empty cellar, but MRI scan cannot diagnose pseudotumor cerebri. MRV is MRI scan of the veins in the brain, performed with contrast to check for venous thrombosis. It can produce a very similar symptom. And the best way to diagnose is to by lumbar puncture. Opening pressure is usually over 25 centimeter water, and cell count and protein are usually normal. This is a algorithm to show you the treatment of increased intracranial pressure or pseudotumor cerebri. The general care, if the patient is on tetracycline, they should stop the tetracycline. They should start working on weight loss, and if there's any sign of anemia, they should be treated. And we can also consider sleep study to check for sleep apnea. If there's no visual field loss other than the above measurements, we can lower the CSF production by using Diamox or Acetazolamide. 500 milligram BID is the starting dose. Sometimes we can also use topiramate or the Lasix furosemide. If the patient has a mild visual loss, they should be started on prednisolone, about 250 milligrams 4 times a day for 5 days with a slow taper. And we can consider serial lumbar puncture to reduce the CSF in the brain to decrease the brain pressure. And optic nerve sheath fenestration surgery should be considered. This should be done by neuro-ophthalmologists. For severe visual loss, they should definitely proceed with optic nerve sheath fenestration, or in the worst case scenario, a VP shunt. The above information were obtained by reviewing iRounds.org and UpToDate.com. You can go to the website of iRounds.org to review a full documentation of this problem. Thank you very much and see you again soon.